The gravity-resisted tests for elbow flexion begin with the patient seated with arms at their side. The patient flexes their elbow through the available range. The therapist provides resistance over the flexor surface of the forearm proximal to the wrist. The other hand applies counterforce for stabilization at the shoulder. Varying the forearm position may influence recruitment of select elbow flexors. For that reason, the biceps brachii is tested with the forearm supinated. The brachialis is assessed with the forearm pronated. The brachioradialis is tested with the forearm midway between pronation and supination.
Bend your elbow. Hold it. Don't let me pull it down. Bend your elbow. Hold it. Don't let me pull it down. And relax. Bend your elbow. Hold it. Don't let me pull it down. And relax.
The seated posture can also be used for gravity-minimized assessment of the elbow flexors. The arm is abducted to 90 degrees and supported by the examiner under the elbow and wrist if necessary. As with the gravity-resisted tests, the posture of the forearm influences the muscle emphasized. Palpation can be used to confirm activity in the muscle of interest. For example, as the patient attempts to flex their elbow with the forearm supinated, the therapist can palpate the tendon of the biceps brachii in the antecubital space. Alternatively, the muscle fibers may be felt on the anterior surface of the middle two-thirds of the arm, with the short head lying medial to the long head. When the forearm is pronated, the brachialis can be palpated in the distal arm, medial to the tendon of the biceps. When the forearm is midway between pronation and supination, the brachioradialis can be identified on the proximal volar surface of the forearm, where it forms the lateral border of the cubital fossa.